All right. Hello and welcome to Catalyst for Healing. My name is Dr. Yanuck. I'm accompanied by a wonderful therapist, Maria Lloyd, wonderful doctor, Dr. Richter. Today's topic is going to be about the importance of sleep, especially as it comes to mental health issues and how it relates to the ketamine space specifically. Um, let's start with maybe the basics. Do you feel like, I'll go with for you, Dr. Richter. Do you feel like sleep is something that we're taught a lot about in medicine?
Not at all. I mean,
Do you remember? We went to med school together. Do you
yeah,
remember a sleep class on sleep?
I mean, I think we had like a random lecture, maybe like
Yeah.
what might be helpful later on. But I think that's one of the things, and actually alongside nutrition, we don't get a whole lot of training on. And sleep is so enigmatic in a way. I mean, there is a whole fellowship. So you can be a sleep doctor, literally sleep specialist. And I think we got more exposed to it through doing emergency medicine
Mm.
to some extent, but still very little. And I think it's so individual in a way that I think we felt the wrath of it during emergency medicine training
Like
without
from a personal
necessarily
perspective.
correct,
Yeah, I agree.
without necessarily being able to address it other than what felt right and what we picked up along the way. But formalized training, not really, or education on that.
Yeah.
So
Yeah. And
yeah.
I didn't get any either as a therapist, which is so funny to me because sleep is foundational for mood and energy, and people coming in with depression and anxiety, you know, they don't even think about sleep routines, and therapists don't even bring it up. They don't ask, how much sleep are you getting? What's your routine with sleep? But let's look at the deep sleep. So I've started educating people because for me it's hugely important if we're talking about mood.
Yeah, I think. Yeah, sorry. Go ahead.
Yeah. So anyway, I have a lot of personal experience I can share because I've had a lot of sleep issues as well. But it is just, I think, so important to be addressed and to be educated on.
I've found myself starting to ask it more, but I'm also hesitant because I maybe feel like I don't have all the answers. I think in medicine, it's really nice where sometimes, especially maybe in emergency medicine, we feel like we have a clear answer for, oh, you have an infection, like here's your antibiotic, right? But like with sleep, it's like, wow, there's a lot of variables. And so I think the way that Western medicine works, where you have only a few minutes per patient, and like here's your intervention to fix it, and we're done. Like that doesn't work when it comes to sleep.
Yeah.
But sleep touches all aspects of our life, and I think when it comes to like the single biggest thing that you could do that would affect your long-term health and your mental health, like sleep is probably it.
It's like number one,
more
for
than
sure.
exercise, more than nutrition, like
100%.
everything. And yet we never talk about it or focus on it.
Yeah.
So maybe let's go to it from a therapy standpoint.
Okay.
How are you bringing it into your practice? How are you talking about it? Let's start there. And then
Well, I like to ask about sleep routines, or I mean, to start with, like, just tell me, how much sleep are you getting a night? Do you have a routine in terms of like what time you go to bed, what time you wake up? And then, I mean, there will be people that are be like, oh, they don't think about it, or they drink late at night, so they go to bed at a different time every night. They wake up whenever. And so, those kinds of things are always like, wow, so that's a big factor, in your stability right there that I can address with them. But I think now we have even more, gadgets that can show us how much deep sleep we're getting, and how important it is to get the different types of sleep. So you guys could probably speak to that more, because I don't know if you're aware of or you use any of them.
I think you feel it the most when it's disrupted, when you don't get it. That's where
when you
realize,
don't get the solid.
when you realize how specifically sleep important and the different phases of sleep. So it's one of the things where we all probably have experienced when sleep is disrupted, it doesn't replenish as much, even if the number of total hours is similar to what we've gotten in a non-disrupted sleep. So, I mean, the different phases of the sleep are important for just recovery of all of your functions.
Yeah.
Everybody usually knows about the REM state of the sleep cycle, which is very important for just memory formation and new cognitive pathways and being able to actually even cognitively function better when you wake up. I would say that one of the things is the environment is a huge factor, right?
Yeah.
When you're getting a sleep and in what environment. To be able to get a non-disrupted sleep that goes through all of the phases and oftentimes utilizes the phase that you require the most, whether it's REM or the deeper states of sleep. So I would say, it can definitely help having ways to track your sleep,
Mm-hmm.
and then augment your environment, obviously, whether it's noise, white noise, whether it's making sure that it's dark enough for you, all
Yeah.
of these things combining to get at least
Mm.
what we've been taught, around the 4 to 5 hour mark of undisrupted sleep is when you start actually seeing much more recovery.
Yeah.
Unless you're literally just utilizing short amounts of sleep to go straight into REM, oftentimes that can be recovered also. But it's known that in a 24-hour cycle, that at minimum 5 to 6 hours before that, you're not getting a whole lot of meaningful recovery when it
Mm.
comes to sleep.
Yeah.
Yeah.
I'll counter that a little bit, and I think it's a little bit of a selection bias with our patients, but I think the data that we get now with people with their wearable devices can lead to a lot of sleep anxiety and can like almost, I don't even, maybe even a little bit of placebo effect. Some of our patients will like, because it is something that I really intentionally ask a lot of our patients, especially ones that I know it's an issue for them, which maybe perpetuates it if I'm being honest, but is this idea that like, oh, well, my watch says I only got like 3 hours of deep sleep and I only slept for 5.5 hours. I know I need to get 7 to 8. Like, I don't know what to do different. And it's like, okay, like, I think we need to go a little bit more towards an intentionality to it, and then just letting what's going to happen. And I think the thing is when we look on the spectrum of things that we prioritize, sleep is almost always lowest, especially as adults.
Right.
Like, I mean, with kids that
Right.
you can attest to,
Yep.
right? With careers, with other social obligations and life obligations, we just like don't prioritize it.
Right.
And I think the only time that people reliably prioritize it are when either they're in a crisis and they're not getting enough of it, or when they start to realize, holy shit, I feel so much better when I sleep.
Right.
For me, my aha moment was when I finished residency, as Dr. Richter alluded to, and I had like gone 3+ years of working. I mean, a third of my life was working overnight, right? And it was like,
how did that affect you?
At the time, I didn't know. I thought it was cool because like I got to like I sleep a couple hours and I had the whole day, and I was like, man, this rocks. Like this is such a good schedule. But then like it became apparent to me like, wow, I'm so emotionally labile, and like I would notice I'm a big runner. I would notice my runs were so hit or miss, and so it was affecting me physically. It was starting to affect me emotionally, but I wasn't.
Right, would be tough.
Yeah, but you don't even notice it though because it just starts to feel normal.
Right.
And I think that's the problem is I think we are literally a nation of zombies. Like people don't even realize it.
Oh, yeah.
And I'm not saying from like an influence standpoint, but they don't realize how much in sleep debt they are.
Yeah.
And so our initial instincts to maybe give medicines to address consequences of poor sleep maybe miss the mark of like, let's address the sleep problem first.
Yeah.
And so then when I went to fellowship and I went to being a doctor beyond, like I'm a bit more intentional about my sleep practice, and I went way too far on one side, like being really regimented with it, and I've kind of backed off now that I've got more control. But it is a huge priority for me.
Yeah.
And I think no intervention I have made in my life has been more meaningful in getting reliable sleep. So if you take nothing, I think this is the problem. It's so obvious.
I know.
Like
I know.
This, but it's like you need to be hit over the head with it like 1,000 times maybe before it to sit in. And I think to tie it to ketamine and the intentionality of it is this is a time where maybe one, you could think about things in a different way, and two, you might be more open to forming habits that are positive.
Yeah.
And this is a critical one, and it's something you brought up to me. Is like, how are we incorporating this into the ketamine space?
Right.
So maybe dive a little bit deeper. Like, how do you address sleep concerns that patients have, ties to ketamine, things like that?
Right. So, I mean, I think there's a couple apps out there that do a really good job of helping educate people. So I could put those in the show notes. Cool. One of them is called Stellar Sleep. Another one is a free app that you can use. But there's a lot of, they call it CBT and also mindfulness practices that can really benefit your sleep. So the first thing is like, what are some of the things you do to wind down in the evenings? I know it's difficult. And so that's kind of, do you start to dim the lights? Do you have any other, like, do you take a bath or do some reading with the right type of lighting? I mean, all of those things are helpful in terms of just winding down, and then people adding maybe a meditation before they go to bed. What a lot of my clients with anxiety have either a really hard time falling asleep because their brains are thinking of everything from the day. And so we might, do some breath work before bed to try to just wind down the nervous system. Add a meditation, journaling, just to get the brain dump out is a good way. The other biggest problem is people waking up in the middle of the night and then they get anxiety about falling back asleep.
Right.
And then they start thinking about everything else. And so that can be useful with that too. Like there's a lot of sleep apps that have like sleep stories that can wind you back down. The meditation is really good because it kind of gets your mind off of that like overthinking. And so those are some things that we'll work on. I don't know.
No,
It's just where I'd start.
Yeah, you kind of pick and choose. Go ahead, Dave.
No, I mean, I second that. That's, in light of the quality of the sleep, oftentimes people focus on the amount of sleep, right? And that's important.
Yeah.
But at the same time, how many times does it happen that you've slept 9 or 10 hours and you feel exhausted, right?
Yeah.
And the quality of the sleep starts with getting ready to go to bed, right? And nowadays in age, it's so much more difficult to unwind from things that are so distracting that you can't even focus on
and getting
the
off
current
screens,
moment.
Right?
Exactly.
What do you guys recommend?
Specifically,
no, like 2 hours before, or
I mean, ideally, I feel for most people that's unrealistic. So, I mean, any time that you can get away from something that changes constantly, a book doesn't change constantly, for example, right?
Right.
And certain things that you can read on have been adjusted to that. It just, I feel like a lot of the times it's just a constant change that keeps priming the brain to literally feed more into it. So being able to do an activity that's a little bit more, in a way, kind of static, even if it's something constructive, like let's say putting together a puzzle, journaling, or something like that, where you are actually focusing on one thing at a time without being constantly distracted. And I think that's huge when it comes to screen time, for sure.
Yeah.
I think it starts from the moment you wake up. I think when I was trying to address my sleep concerns that I was having, it was like, okay, like what are the things I'm doing throughout my day that can like set me up to sleep successfully? And it started with like caffeine intake, right? We're in the medical space, like we exist on caffeine,
right?
Because we're always like sleep deprived. And I was recognizing like, okay, I'm having like a decent amount of caffeine, and I'm also starting to have it like in the afternoons. And I always thought of myself as someone that like I can have an espresso and then fall asleep an hour later.
Yeah.
But there's like strong evidence that shows even if you are sleeping, it's actually not restful sleep.
Correct.
And there's actually real issues with sleep when you still have caffeine in your system. Ketamine on my mind. But then there's also other things like exercise for me. Like I reliably, if I exercise, I'm going to sleep better.
It's true.
Every time.
For sure.
Also, I'm going to poop better. That's the thing that people don't talk about. Everyone thinks that like, oh, I'm constipated all the time. Like you have to move.
Yes.
Anyway, sidebar. I sleep
when
better.
you say high intensity exercise,
honestly, it doesn't just movement.
Okay.
Like I mean, if you do 20 minutes of yoga, if you do 20 minutes of power walking, climbing, weightlifting, high intensity, something that you want to do ideally, that brings you some joy. Getting outside is really helpful. If that doesn't work for you, finding something inside that gets your heart rate up, you will feel better. The endorphins go, and you will sleep better.
Yeah. And
then, kind of leading into the nighttime, I am someone that I cannot go to bed hungry, right? And so, like, I am someone that exercises a lot, and there were times where I wouldn't even realize that was the signal that was keeping me awake. But like I have my dinner, and now I very intentionally have my second dinner, and I eat like right before I go to bed. This doesn't work for everyone, but you have to start to realize like what are the signals that maybe are disrupting my sleep. Right. Another thing is like I can get really locked into something if I'm like the way my mind works, if I'm interested in it. So now when I go to bed, I'm reading almost always relatively boring, like historical fiction. It can't be nonfiction.
Yes, that's so true.
I'll try and like memorize all the things because I'm like learning cases.
It has to be boring.
It has to be boring. You can read interesting books during the day. Night books are meant to put you to sleep, in my opinion.
Any wind down.
Because otherwise I'm like, well, shit, I gotta finish this chapter. Now I'm like, oh my god, this is so boring, and then I just fall asleep. I've tried all those things. For me, I used to have a little bit of an issue of the falling asleep. I've tried the breath work. Meditation, not so much, but journaling I tried, and I think they all helped on the periphery.
Yeah.
But those things that I listed were the things that worked for me, and I think
everything's going to work different for
someone.
Trying
to figure out what are the things that you can do to optimize it, and then at the very least, just acknowledging that eventually your body is going to sleep. If you're being intentional about it, and if it's waking up in 4 hours and you can't fall back to sleep, get up and do something. At some point during the day, your body's going to want to go down and it's going to sleep, and I think a lot of the sleep anxiety that is related to the can't fall asleep after I wake up is people just being like, oh, I just lay in bed for 2, 3 hours and I can't fall back to sleep. Like,
Yeah.
just start doing something.
Right.
And you'll sleep during the day, you'll sleep at night, your body will start to re-equilibrate. But our body's telling us something with this, and we have to listen to
But
it.
I think that's where like going to bed and waking up at the same time are really effective
100%.
in helping people with their routine
Yeah,
of getting the right sleep, because then your body, it's almost like just starts getting used to that and starts winding down at a certain time. And if you add a little routine, like maybe you're taking a bath before bed or taking a puzzle or whatever that is to wind down, you just start getting used to doing that every night, and then you sleep better.
Yes. Yeah. So let's talk about a little bit about our space. I think people with depression and anxiety,
Yep.
It's kind of a chicken and the egg thing.
Like, they always have sleep issues.
All across the board sleep issues.
Yes.
They either sleep way too much or they're not sleeping at all. And it also, each feeds into each other. The depression makes that worse, and then that makes that worse. I think there are medicines available to help people sleep. What are your thoughts on those? Like, I mean, like, starting with, we have our melatonin.
I try with the natural.
I don't know about these things?
Yeah, but
I think there's two ways to attack sleep, right? Keeping you asleep and inducing the sleep, right? So there's, when it comes to, let's say, melatonin, it's more of the induction of sleep, right? And then there are medications that are more like on the spectrum of sedating you actually for prolonged periods of time that will keep you asleep for longer. Ultimately, I think it's everyone, and I think this is just common sense. I think everyone would agree that if you can simply just create a routine like we talked about and induce sleep in the right way, I think that's the safer ground than using medication that just keeps you asleep, right? Because you're just training your organism, your system basically, to create a routine. And then ultimately you're allowing the body and the mind to take over. So in that sense, I would say starting with the habits that we just talked about, absolutely. And then maybe if there is, and there are rooms for medications, like I've had patients where it's difficult to just stick to strategies like this and be able to fall asleep. That's the reality of life. So I think at least starting with something more benign to induce sleep after you've taken care of some of the healthier habits, to try to incorporate those before you were reached to anything that's actually more and more sedating on a long-term basis. So that's how I would actually always coach patients, is to start with the habits that we talked about, try to do those, and then try to induce sleep with something that's a little bit less potentially heavy on the system and side effect provoking, and it doesn't naturally disrupt the stages of sleep, because a lot of sedative medications will do that. And there is room for those, but I think initially start with that.
I kind of assess it too as, just like with moods, is it mild to moderate or is it moderate to severe? So if it's mild to moderate, maybe start with magnesium, L-theanine. Some of what else would you recommend that's natural?
Melatonin is not unnatural. So I would say melatonin at low doses can be very helpful. And it's induction of sleep. It's something we naturally produce. So I would say that there's space for that as well. Yeah.
And if that doesn't work, I have had clients with success with CBD for sleep. And then if they're severe and they're not sleeping at all, get some trazodone, get some.
That's when
it's like you go to the bigger guns, because it's more important that you get the sleep. Then at that point, you're not gonna. When I see people with severe insomnia, it's like those sleep habits aren't going to kick it for them,
That's true. There might need to be a jump start.
Exactly.
Absolutely.
Exactly.
But the habits are so important.
They're so important. Yeah.
I feel like most people at some stage in their life will go through some kind of a sleep disorder, even if it's minuscule, even if it's just a general sleep disruption. And to be able to create a habit that allows your mind to be prepared for sleep, I would say it starts there, inducing the sleep.
Yep.
And then the other things will fall in place if you have to help it a little bit in the beginning. Absolutely.
Right.
Yeah. I think my view has evolved a little bit over time to be more compassionate to people with sleep disorders, where I used to be maybe a bit paternalistic in the way I thought about it, of like, I know what's best for you. These medicines are only going to make things worse in the long run because they're habit forming and you're not going to be able to get off of them.
Yeah.
And I have a bit more compassion in the way that I prescribe things for it. I don't, I can count on one hand the amount of times I prescribe sleep medicine. It's just not my specialty, right? Like, at the end of the day, it's either the primary care doctors are doing it or sleep specialists.
Yep.
And there are unique situations that people should get checked out for, like obstructive sleep apnea and other really rare but important sleep disorders. But assuming it's just your idiopathic insomnia, making the lifestyle changes needs to come at the very least concurrently with these medicines. And these medicines need to be taken very intentionally, with the idea being that these are to kickstart the change. Yeah. And ideally are not being taken on a daily basis. Right. Like things like these, like Ambiens and stronger meds, if you need it, sure. But like, make sure you understand the risks of it and make sure you are not taking this every single night, because that will for sure cause rebound insomnia where you can't get off of it. Yeah. Anyway, I think I'm broaching into territory where I am not as informed as a lot of people, but I think that generally that's how I think of these things, and I will give these medicines to people if they desperately need it. Yeah. But I think to walk back a little bit, there's a lot of things that could be done before that. And I think this is where engaging in psychotherapy, working with your psychiatrist, and then if you are at a point where it's so severe, these things like ketamine can actually help with sleep. So uniquely with ketamine, I've had many patients, tons of patients with severe insomnia that the night of their infusion, they've had the best sleep of their life.
Really? Interesting.
Yes, like all the time. I didn't know that. Okay. And I have had many patients who never once had insomnia, and then when they get ketamine, they can't sleep at all.
Well, that's what I've heard more of, so that's like, interesting.
It's really interesting, and I don't know how to explain it, but it's always like a really transient thing, like it kind of flips for that night, and then they kind of settle back down to their baseline. Yeah. And so for the insomnia patients, I prepare them for it. This could be really beneficial for you that night, but it's going to probably come back, and so we have to think about how can we set good intentions using this whole space as the mind is open to kind of think about what are the things I want to do throughout the day that's going to set me up for success with sleep. Yeah. Because at the end of the day, like, the ketamine catalyzes the start, and then you've got your internal mindfulness things, you have your psychotherapy, you have your sleep, you have your nutrition, you have your exercise. Like, these are all buckets that you should think about as equally important to everything.
Yeah. And as we've talked about, that 48 hours after treatment, or 72 with the neuroplasticity being heightened, it's such a good opportunity to build that new routine, because you're going to be motivated to stick with it when you have that, mood lift. And so that's where you can just really, that's why I tell clients, like, well, because they're also like taking time off work, they're slowing their schedules down, they're, trying to be more relaxed. It's such a wonderful time to start getting some of these sleep routines in place. Yeah. One other quick technique, I'm learning hypnotherapy right now, is you roll your eyes back with your eyes closed when you lay down, and supposedly it's calming on the brain and somehow kind of allows your thinking to shut down a little bit. So that's another thing that people can try.
Sure. I mean, to each their own. Whatever works for you. Like, for me, it's reading a really boring book. Yeah. Like, that's thankfully I'm pretty lucky that way. But I think some people have to get really creative. Like, there's people that are like taping their mouths shut now. Have you seen that?
Oh yeah.
It's called like hostage tape, and the idea is to like promote nose breathing. I was like,
I've actually done it. It actually really it's
interesting.
It's not comfortable, but I've tried
everything that's in the health and wellness space.
But for me, baths, like, I love Epsom salt baths. Like, it's just very relaxing. I don't know. That helps me sleep.
Yeah. I just think, as a society, we're so high energy and just like go, and then we get in bed and just expect to turn off. And it's like, no, you got to set yourself up for success. And maybe it's more of a reflection of how you're spending your day than like what your immediate sleep pattern is. Yeah. Maybe we can all reflect on that and take a little bit. All right. So what are the take-home points from this? What did we learn today?
Habit forming, just like everything else. Yes. That's huge, right? I think you have to, like you were saying, and you guys are both saying it, you have to set an intention, and that's an activity, right? You're only spending a third of your life on it, so might as well set an intention.
Right.
To it, right?
Good
if you
point.
compare it to anything else, how often you eat,
third of your life,
or exercise, or even work, you're probably spending the most time on sleep since you were born. So setting an intention to actually make it habit forming, I feel, is huge with every activity. Sleep should be no different.
That's a great point.
Yeah.
I think we covered it.
Right. Yeah. I think we covered it.
Get your sleep.
Yeah, get your sleep. Good luck, everyone out there with that. All right. Well, thanks for joining us, and we'll see you guys next time. Bye.
Bye.